In part 3 of our Regulation Nation series, we look at health care. While the Trump administration has not technically gotten rid of Obamacare, correspondent Doug McKelway tells us tonight it is going after one of its primary sources of funding.
In a sign of how urgent it was, as the parade was winding down, 7 hours into his new job, the new president not yet changed into his inaugural ball tuxedo, he signed his first executive order in the White House, directing agencies to, quote, ease the burden of Obamacare. But it was only symbolic, followed 6 months later by an all-too-real defeat, as Senator John McCain cast a deciding thumbs down on repeal and replace. Now, taking up a chisel where the sledgehammer failed, Mr. Trump has been chipping away at Obamacare. In October, he signed an executive order allowing insurers to sell low-cost health insurance with fewer benefits, lasting up to a year. It took effect on Tuesday. It also allowed small businesses to form health insurance associations across state lines and directed agencies to consider changes to health reimbursement arrangements, or HRAs. They give employees more flexibility with company contributions to pay for out-of-pocket medical costs or new plans.
It's laid upon the table.
Separately, included in the just-passed tax bill was the individual mandates repeal. Combined, these actions may serve to deprive Obamacare of what it most needs: young, healthy participants.
It is suffering from what's called adverse selection. That is, people are joining the exchanges mainly if they're heavily subsidized, or also if they have a health condition where they can get pretty good premiums.
Critics say chipping away at the law is coming at a cost.
We have seen that the efforts to undermine coverage have driven up premiums for the middle class, for people with pre-existing conditions. So when you see these sorts of efforts to sabotage the law, they're the ones that really bear the brunt of it.
Does it mean a death spiral for Obamacare?
The basic structure of the law is still there, especially and most importantly, the money.
Because Congress hasn't been willing to stem its funding, Obamacare lives on, although wounded by President Trump's executive orders. But the stroke of the next president's pen may bring it back from the brink. Brett?
Doug, thank you.